Figures there. Well, what do the people on the front line want from tomorrow's announcement? Joining me now is the Chief Executive of the UK Homecare Association, Jane Townson. We did invite the government to join us, but nobody was available. Jane, thanks for joining us. Has the government listened to providers like yourself?
Well, we have been engaged in conversations about the white paper, many across the sector, people using services, experts from all different areas. So to that extent, we have been listened to. But in terms of the short-term problems that Lewis referred to, there is no sign that they are going to be addressed. So what's in the white paper are some very worthy aspirations that all of us can sign up to. But those aspirations will just remain words on paper unless there's a plan and investment aligned to that plan. And that's the problem at the moment. We can't see that. So we are really
5.4 billion over 3 years. Is that just not enough as far as you're concerned?
Nowhere near enough. That works out at 1.8 billion a year for 3 years. And the industry analysts and the think tanks estimate that we need between 10 and 14 billion to make a real difference. And what we're seeing now is that all government money pretty much is poured into the black hole of NHS acute hospitals. And we're not seeing a meaningful shift towards investment in the community and social care. And the whole system is connected. Yeah. What we're doing is we're neglecting people in the community, waiting until there's a crisis, blue lighting them into an ambulance queue. When they do eventually get into hospital, they sometimes struggle to get out again in a swift way because of lack of capacity. So the NHS cannot solve its problems unless we invest properly in community-based and social care.
So there's already been a sort of allocation indicated, £500 million. Like your workforce is about 1.5 million. That sort of works out at about £2 a week per worker, by my maths.
That's right, and that's not going to address the long-term underfunding that directly leads to poor pay terms and conditions for the workforce, and also restricts providers in how much training and supervision they can give. The 500 million will probably be designated for portable care certificates, streamlining disclosure and barring service checks, and some wellbeing services for care workers. And all of that is valuable, but it's not going to get to the crux of the matter.
But the government's already had to raise taxes to try and help fund some of this. It will say it's doing as much as is feasible. You know, there are other calls upon the public finances right now. They're doing as much as they can.
They have raised taxes, but the vast majority of it is being designated to the NHS. And what we're saying is that that balance of funding isn't right. If the NHS wants to reduce its waiting lists, we need more investment elsewhere in the system. Just pouring it all into acute hospitals isn't going to solve the problem. And politically, this could cause problems too. So, you know, we really need to arrive at a situation where all of us can live well at home, surrounded by people that are important to us, connected to our communities, and that people who need support and care can access it in a timely way, in an affordable way. And that doesn't vary according to region. At the moment,
Jane,
race inequalities.
Right now, there's the concern over a variant that may or may not cause another wave. Is the social care system ready for such a possibility?
Well, we've been ready for adopting infection prevention and control measures all along. PPE, testing, regular testing, encouraging vaccination, and all we can do is carry on with all of those precautions. And you know, we need to really understand that people in their own homes also need support. There was a meeting at the Department of Health and Social Care today that excluded representatives of home care providers, and you know, we need to look at this as a system-wide issue, but we are as ready as we can be.
Okay, well, we must leave that there. Thank you very much for joining us, Jane Townson, on the important issue of social care bill, which we think is coming out tomorrow.